very much, sir. Yeah, thank you very much, sir. Si Attorney Samoto, matagal na kami magsama, and actually I see a lot of familiar faces along with new faces as well. You know, I've been doing a lot of media work. Usually, di ba, doctor allergic sa media yan eh. But you know, I felt so strongly about my advocacy that I felt that the best way to get the word out is actually to partner with media. And natatawa nga ako every time pumapasok ako sa isang media briefing or sa isang show or something, tinitingnan ko na rin yung mga angles, ano ba yung magiging point ng story, ano yung angle natin. So parang in a way, I feel like I'm starting to become one of you guys na rin. So it's actually kind of gratifying because I really admire the media. In fact, because I'm a scientist, isa sa mga ginawa naming studies dati was, tingnan namin kung ano talaga yung impact ng all of this media stuff that we're doing on people getting tested for HIV. And apparently, every time we would come out with a story, either print or lalo na pag TV, pag news TV, umaakit ng 5 times yung mga nagpapatest for HIV sa clinic namin. Problem is, after mga 3 months, bumabagsak ulit. So, kailangan talaga natin i-sustain. So, that's the bottom line. So, to give you a bigger idea about, kasi sabi nga ni Attorney Samoto, we're talking about the RH bill, di ba? And we're talking about HIV, these kinds of things. What is the whole point of this? Applicable ba talaga ito sa atin? Una-una, nagsisex ba mga Pilipino, di ba? Kasi yun naman yung root ng problem eh. Well, obviously, nagsisex sila kasi ang dami-dami na natin. Pero, gaano kabata? And ano yung nag-i-increase sa kanilang risk in terms of getting not just HIV, but also sexually transmitted diseases? Siyempre, nakatutok tayo sa HIV kasi yun, nakakamatay yun kung makuha mo yun. Pero marami pang ibang tinatawag na collateral damage pag magkaroon ka ng sexually transmitted disease, di ba? For instance, may asawa ka, paano papaliwanag yun? Binigay mo sa asawa mo yung STD. Di ba? So mga ganunong bagay, nakakasira ng lipunan natin. It's very, very important that we're aware of these issues kasi hindi naman yan mawawala dahil hindi natin sila pinapansin eh. In fact, mas lalong lalaganap yan dahil yun nga, hindi natin nagtutunan ng pansin, nangyayari, and then we pretend like it doesn't exist. So the title actually which Attorney Samoto came up with, Sir Joey, is Are Filipinos Ready for a Sexual Revolution? Loaded question yan eh. Kasi, actually, tapos na. You'll see, and I'll try to make the case, na yes, Filipinos are having sex, and they're having sex younger, and they're having sex with multiple partners. Okay, so I always like, I found, with all my time with media, statistics are nice because you can quote them. But if you try to put a face to something, it becomes more human and it's easier to relate as people. So I'll tell you about this. This is from my diary, actually electronic diary, because sometimes when I really feel strongly about something, I start writing about it. I have a lot of very private and very emotional entries in my computer. That includes when I lost my son, he was born premature. So yung mga ganun, medyo private talaga yun eh. But I thought I'd take this one to share with you kung ano talaga yung nararamdaman ko kung as a doctor when I'm seeing one of the patients. Okay? And this happened last December. Okay, so JJ looked at me with cold and blinking eyes. The tip of the breathing tube jutted out from his open mouth like a creature from a horror movie. His mother quietly sobbed in one corner of the bed. His father looked off into the distance trying to remain stoic. So, ano to? Hindi ko na sasabihin ko anong hospital. Pero isipin nyo, ano yung fluorescent light dyan. Tapos, so may body dyan, nakatingin siya ng gano'n, wala na siya nakikita. Tapos yung nanay niya nakaupo, iyak ng iyak, tapos yung tatay niya on to one side. And then of course, I changed the names kasi privacy to eh. Alright? But 3 days before Christmas, I stood at the foot of JJ's hospital bed, the fluorescent light lending a sterile pallor to his graying skin, the streaks of dull red slowly appearing on the arms as the blood clotted on his veins. In other words, hindi na umaandar yung dugo niya dahil nag-stop na yung ano niya. So, actually, medyo umiyak ako nung tinatype ko to. Kasi parang tinatry ko talaga i-crystallize sa utak ko ano yung naramdaman ko at anong nakita ko. And now, parang I'm trying to share it with you. If you step in my shoes, na oh no, kailangan ko ipaliwanag sa nanay niya ngayon kung bakit namatay itong batang to. At sino ba si JJ? 20 years old, med student. Okay? Whole life ahead of him. He's looking forward to the day when he could be called doctor and entrusted with the lives of his parents. He was popular, intelligent, good-looking, his grades were excellent. And he had many friends, some of whom have noticed, I've talked to some of the friends, that in the last few months, JJ had become increasingly thin, fatigued, and depressed. Most of them just notched it up to the rigors of medical school, mahirap talaga medical school. Little did they know that JJ had HIV, and now he was dead. Okay, this is 3 days before Christmas. And people ask me, ano ba yung motivation ko para gawin yung ginagawa ko? Doctors allergic sa media, di ba? So, ang hirap-hirap ng ginagawa na to. Mawawala ako sa clinic para makipag-usap na sa inyo. Nawawalan ako ng pasyente. So, nawawalan ako ng pera, actually. Di ba? But this is the motivation. Bakit? Hate na hate ko talaga. Pag namatin ako ng pasyente, lalo na pagbata, papaliwanag mo sa nanay niya. Mas hate siguro nung nanay, di ba? kasi anak niya yun eh. Mas hate lalo ng pasyente kasi patay na siya. Pero ito yung mga nararamdaman namin na hindi nyo nakikita dahil, there's a lot of privacy surrounding these things. And of course, hush-hush, ayaw naman magsalita ng mga yan sa media. Siyempre, may HIV yung namatay, di ba? But I'm trying to give you an idea of what it feels like to be in my shoes. This is what I see every day. It happened 4 times in December. 4 na 20-plus-year-olds yung namatay sa akin noong December. I had much more HIV patients than that. I had mga 20. But 4 of them died. And these were kids in their 20s. Every single one of them has a mother. Lahat naman tayo may nanay, di ba? So next time, isipin nyo na ang HIV behavioral problem yan, hindi siya, alam mo yun, they brought that upon themselves. So, ipaliwanag nyo yun sa nanay ng pasyente. So, can sex kill? Yes. Yes. Okay. So, basic questions for sex. Is it more fun in the Philippines? Di ba? Para may slogan tayo, pero siguro hindi yan nilalabas ng Department of Tourism. Sex more fun in the medyo huhulihin tayo nun. So, what are the risk groups? So, sex workers, okay, sige, di ba? Men who have sex with men, they have a lot of sexual partners. Pero yung lumalabas talaga ngayon, nakikita natin is the youth, pabata ng pabata, ang mga tao nakikita ko sa clinic na hindi lang HIV, kundi sexually transmitted diseases. Okay? Meron akong isang pasyente, full-blown AIDS, 21 years old. Now, it takes 8 to 10 years to develop full-blown AIDS from the time you get HIV. So, kailan siya nag-sex? Nang nahawa siya? 13. Exactly. So, hindi naman siguro, madali lang yung i-quantify in your mind eh. Pero hindi siya nagre-register hanggang sa, sino may anak dito? Isipin mo yung anak mo. Okay? Or kung wala kang anak, and then you're young naman, or meron ka nakakabatang kapatid, isipin mo yung nakakabata mong kapatid. Isipin mo patay. Okay? Or yung best friend mo, nung mga 20 years old kayo, with a fatal illness, mamamatay. In fact, sa laganap ng HIV ngayon, hindi lang sa sex workers, hindi lang sa men who have sex with men, pati sa mga all walks of life. Yung med student, we have doctors, we have lawyers, we have businessmen, we have people from all walks of society. Isipin nyo, ngayon exercise lang. Think of somebody that you know who died young in the last 3 years. Mga 20 to 30 years old. Or even mga 40. Okay? Na mysterious. At ang sinabi nila, pneumonia. Malamang na namatay yun ng full-blown AIDS. Okay? Kasi ako, alam ko, I think at least one of my classmates died of AIDS. Alright? So, ganun siya ka-personal. Kahit hindi mo iniisip na hindi mangyayari yan sa akin, although pwede mangyari sa'yo, isipin mo mga kaibigan mo, mga kasama mo sa trabaho, and even if you don't have risk factors, as long as you're having sex with your partner, paano ba yung partner mo binigay sa'yo? Diba? Sinasabi nga namin, only 6% of the patient, of the population that is at risk for HIV has been tested, sabi ng Department of Health. So yung nakikita natin ngayon, tip of the iceberg lang yun. Okay?